Morning, everybody, and thanks very much, Paul, for inviting me. I was just musing that I think the last time I addressed this conference was in the days of the Association of Social Alarm Providers in Blackpool. I don't know if anybody was there on the night we went on the trams, but I'm sure that if you are, you're as long in the tooth as I am. I've been very much given a brief to talk about the state of the housing sector and the relationship around that and technology, in particular around building solutions for tomorrow. As I was coming over this morning across the bridge, I picked up some news about the state of the housing market for younger people. And just a quick show of hands, how many of you own your own home? Right, the majority of you. What you may not know is that by 2025, just a quarter of 20 or 30-year-olds will own their own home. And we are very much living in a generation where people are living longer, but also younger people are living longer with family members. And often it's not till the 30s. And people are moving into their own home, and that's partly due to a significant shortfall of housing supply across the UK. And I'm going to sort of capture that and identify where some of the drivers for integrating much more better with technology-enabled solutions, and I particularly like the idea of technology-enabled living. For those of you who don't know about the Housing Lin, the genesis of the Housing Lin is the Integrated Care Network in the Department of Health, which was also responsible for managing the Telecare Lin and the whole system demonstrator sites, ably supported by Mike Clark and a number of others. We work now within England and Wales, providing knowledge, information and opportunities for networking. But there has, as I said, been a significant interest in issues around housing, and particularly around housing for an ageing population, and real concerns about what the viability of social housing in particular will be for older people, especially in the light of the Housing and Planning Bill, and the challenges for housing associations, and particularly around the right to buy, and also things like -1% rent increases between now and 2020. And part of that is because there's no real clear vision what the future of housing for older people will look like, but either in the specialist housing sector or indeed the retirement housing sector per se. And some of the statements that have come through over the last few years have also sort of talked about, are there ways to look at housing for older people as a way to be a catalyst for changing the way that we think about the housing market and the types of services that you can provide to support people live well at home for longer. And again, it's sort of trying to capture that was a really important select committee chaired by Lord Filkin, some of you who will know, who talked about the fact that there is too little specialised housing provision within the UK, and there's a whole lot that needs to be done in terms of the supply side, and particularly around how we build attractive, aspirational, accessible and adaptable housing for people in later life. And that report back in 2013 has subsequently been picked up by industry, and particularly the construction and the surveyors of this world. So organisations like Knight Frank, Savills, JLL, many of you who will know within the housing sector have identified that there is still a significant shortfall of good quality housing for people either wanting to move to that or to stay put. So some of the challenges is how do we move from the left to the right? And I don't mean politically, Ray, but in terms of the types of quality of accommodation. And how do we build in the appropriate building management solutions, the telecare, the assistive technologies, the aids and adaptations, so that we design, build and involve older people in types of construction of the types of communities they want to live in. So it's not just about building homes, it is about building aspirational communities. That within a challenge of an ageing population, where at present there are about 9 million older people over 65 who can only access about 1.3 specialised accommodation within England and Wales in particular, and indeed also care homes. I was in Bristol recently and learned that one housing association there, for every one night of the year, 12 of its residents are in an acute hospital bed, and they've calculated that costs the NHS over £5 million a year. So housing has a way to think about how it can do some of the prevention, improve some of the productivity around the way it manages its services, because in fact the majority of people want to stay in their own homes and live, as I say, well into later life. So again, how can housing play a role within that? Well, a quick overview of the state of the housing market. As you indicated in your show of hands, the majority are older homeowners, but increasingly people living in social housing are of pensionable age or have a long-term condition, and it's estimated at least 40% of all people in housing associations stock in social housing have a particular social or health care need. And that also has major implications, not just on the supply, but as I said, in terms of the improvements, both in terms of the care and support services going in, but also in terms of the accessibility and the adaptability and the suitability of accommodation. And I'll come back to that in a moment, and particularly in relation to things like the Care Act that many of you will be familiar with. But that shortfall of supply also has a major pressure, both in terms of what is available and what the choices are locally, but also because of the lack of choices, it also drives up cost. So both in terms of the availability of mixed tenure accommodation and outright sale, it has a real pressure on the type of market that's being generated, and particularly for those working in the leasehold market. An average two-bedroom retirement housing now is about £280,000. They're expecting somebody to downsize in effect from about 450,000 units of accommodation. Not everybody, and particularly the 40% in social housing, have that type of equity. So again, how do we create a universal offer that can improve the life chances of older and vulnerable adults? You can see from this graph very quickly a piece of work we've developed with ADAS called ShopAt, the Strategic Housing Older People Analysis Tool, looks at the type of overview of the type of supply. We have an oversupply of some of the sheltered housing, partly due to poor quality. It's not technology enabled. Often it doesn't have a warden or a scheme manager. But we're increasingly seeing a move to extra care, enhanced sheltered housing, and indeed we're also seeing an increase in the residential care market in some places. In relation to technology, what that means is we're going to really be clear about what our offer is. And this is a piece of work that was undertaken for Lord Best and the All-Party Parliamentary Group, which looked at the different lifestyle choices people were making at different cohorts. Now, it may not be particularly clear to you at the back of the room, but in essence, along the bottom, the sort of offer of a general care offer backed by technology in looking at the community resilience, technology was a really important feature in delivering local care and support, but also increasingly self-care and support. From a health perspective, they also identified some significant pressures in terms of preventing people moving, admissions into hospital, supporting transfer of care. I'm sure things that came up yesterday and earlier today. You may not know that older people in particular account for 55% of GP appointments, 68% of outpatient appointments, and 77% of inpatient appointments. If you can get your housing right, it can contribute to some of the delayed charges in readmissions into hospital. But more importantly, the majority of people who are frequent flyers of the NHS, and this is work undertaken by the Building Research Establishment that estimated at least £1.3 billion it costs the NHS to support people at home because of poor housing conditions. It makes it really important to think about the quality of the housing and the types of utilities, solutions and services that we can integrate in those. The cost argument is very much driven around the types of value, both in terms of the personal and social value, but also the dividend to the wider health and social care economy. And again, I'm sure you've heard a little bit about the cost efficiency and effectiveness in relation to prevention of falls, trips and falls, things around improved hospital admissions and discharge, and indeed some of the work that Paul's done in his commission looking at the right place and the right home. So again, we need to think about the wiring, not just the physical wiring, but also how we build the social networks, the contacts, the communities, to move from sort of an analog to digital. But is that happening at a national level within the housing field? 4 or 5 key things are coming through. One is this all-party parliamentary group that Lord Best chairs, and something now called the Happy 3 inquiry, looking at the types of houses that are being built and the management of those houses and how suitable they are in the long term for people to live good quality lives in independence or interdependence. And he coins the phrase care ready. We need to make sure that technology is care ready and the accommodation can accommodate that as well. There's an important part of the Care Act that looks at the suitability of accommodation, and again, I'll touch on that in a minute. The relationship I've already indicated with health is critical, and particularly around the 5-year forward view, but it's also in England around the Vanguard sites, looking at some of the work that Airedale and Calderdale are doing, but also looking at the work that Barnsley and Knowsley and others are doing around extra care and trying to integrate housing within the broader health and social care agenda. The major issues around improving supply of housing through releasing NHS land. Again, can we look at the InfoNet, the technology type solutions in terms of creating healthy neighbourhoods in relation to that? Can local authorities be better armed around looking at the types of building regulations and moving towards things like lifetime homes or age-friendly communities, perhaps on a par with things like dementia-friendly communities? And again, coming back to the viability, some of the real challenges around the housing and planning bill. It's all about starter homes in the planning bill, not smarter homes, the agenda that we're really concerned about. So what's the housing sector doing to sort of respond to these at a very high level? Critically, we've brought together organisations like NHS England, Public Health England, DCLG, Department of Health, HCA in England, and again, there's a collaborative agreement in Wales similarly, but in England it's called the Memorandum of Understanding. This is about bringing those industry leaders together to look at the health and well-being of local populations and seeing where housing and the wider agenda fits in. Unfortunately, that wider agenda doesn't explicitly say technology or telecare, but again, it's about how we enable that to deliver housing solutions. You will have heard about the Better Care Fund. Well, a core part of the Better Care Fund includes access to things like disabled facilities grants, but also potentially using monies to support the delivery of different types of telecare and social and lifeline platforms. And a critical part of the new supply is something called the Care and Support Specialised Housing Fund, a Department of Health initiative administered by the Homes and Communities Agency outside London and the Greater London Authority inside London. And phase 2 of that is due to be announced in the new year. I was hoping that we would have heard about it prior to the spending review, but I believe it's been delayed by a month or two. So, coming back to the Care Act, for those of you working very much on operational issues, or indeed strategically with your local authority partners, as well as the third and voluntary sector, housing is now set out as a suitability of accommodation in terms of the general duty to promote well-being. So again, as part of those assessments, there are opportunities to think about some of the ways that housing can be assessed as looking at the life chances and holistically at the needs of individuals. It's not just about the bricks and mortar, it also includes the range of housing and related support solutions if you look at some of the accompanying guidance, and a critical delivery of this is also about improved information and advice for local residents and citizens about their options locally. So how do we move from that to delivering what people want? Well, again, some of it is around being much clearer around the preventative offer, looking at the development of intermediate care and reablement services, how we can support people better at end-of-life care, avoiding hospital admission, or indeed looking at things like how one, through technology, can support hospice at home. And the critical things around how to support many older people who experience or feel isolated and lonely in their own homes. So again, coming back to those sort of issues, can we support and improve some of the production, but also some of the productivity to make better use of the technology and equipment to support continuing health and social care? And that includes self-care, self-management, and again, building effective communities. And again, I was reading a paper last night about an organisation called PumpCo, which again is very much around co-creating, co-designing local communities and using technology as an integrator. And ultimately to use that to create less dependency on both high-cost care, but also to improve the relationships that people themselves have. And does this work? Well, the evidence is starting to emerge. From a housing perspective, the Department of Health's Fund for Specialised Housing Fund has been reviewing some of the important sort of features of extra care housing. And it's identified 3 or 4 critical things. One of them is around improved accommodation, improved quality of accommodation. Others around combating loneliness and isolation, personal comfort, as well as things like improved diet and well-being issues. So again, there's some growing evidence around this, drawing on something called the Ascot framework, those of you who come from a research background. But I also think for those of you working in marketing, and particularly within a housing sector, that we poorly market ourselves in relation to this. And it's often that we need to think about where does specialist housing add value to the housing and health world, and particularly around delaying a move to costly residential or nursing care, preventing homelessness or supporting better well-being in the home, how we can mainstream our housing offer, both in terms of design and accessibility, but also how that might offset future health costs. And there's a critical role for those of you working in this sector to integrate and work in partnership with organisations like home improvement agencies and handyperson services, tackling both aids and adaptations, but also at this time of year, some really important things around energy efficiency and fuel poverty. Again, that link between health and housing is critical, and particularly in these times of years. That link also builds into things like the relationships with environmental health, so tackling disrepair and environmental conditions that can lead to long-term conditions. And again, your former colleague, Norman Lamb, has been looking at issues in relation to mental health services. So summing up, I'm going to skip a few pictures and slides. We need to think much more about whether we're playing Monopoly. So again, is it a community chest, or is this all to chance? So I think we need to think about the way we need to avoid paying the fine. What scope is there for better integration, planning and commissioning, housing and related technology-enabled services? What's the community chest in terms of the assets that you have in those local communities? How can you look at the chances? What are the market opportunities for growing the types of services and the products that you have? How can that enable you go past go? And have you got access to the right information and intelligence to help you to play? So in conclusion, some useful resources from the Housing LIN and soon a rejuvenated Telecare LIN to help you along the way. But I want to leave you with this slide. About this time last month, it was International Older People's Day. And when you're driving along down the A13, Ray, you probably see this slide on the left, older people, you know, that's the care home. But actually, let's celebrate older age. As I said, the majority of people want to live well in their own homes, and technology enables them to continue living. Thank you.